The latest news, updates, and more from the world of health and medicine. This is Medical Minutes, brought to you by Community Health Network.
Our morning checkup brings the newest twist in a topic that has already had Dr. Janelle Gordon's full attention, the contentious questions around COVID vaccinations. You had an earlier appointment for us, if you will, helped us understand this deep divide on the topic. It is still messy, correct?
Still pretty messy from what we're seeing. So we know that last week we had updates from the Department of HHS, or Health and Human Services, stating that COVID vaccinations would no longer have emergency use authorization. And that kind of went throughout the nation, had everyone up in alarm, especially medical experts. And so now what we're seeing is that our retail pharmacies, which in recent years had been offering vaccinations,
your CVS's, things like that.
Yes, they're now rolling back those offerings. And in 16 states, you actually need a prescription to receive a vaccination. However, in Massachusetts, Nevada, and New Mexico, even with a prescription, an individual cannot get a vaccine at that
because that emergency use authorization was pulled back, and they don't want to deal with it, right?
Don't want to deal with it.
Wow. In Indiana, we're not one of those states at this point, correct?
So thankfully, as it stands for now, Indiana, you still can get the COVID vaccination at your local Walgreens or CVS, as well as your local doctor's offices.
I was going to say, if you go to your GP, if you go to your doctor, internist, that they can provide one as well.
Yes.
Okay. Something of a shockwave from Florida, and this goes beyond the COVID vaccine. This is, it seems, all vaccines. Clear up for us what's happening in Florida.
So yesterday during a press conference with Florida Surgeon General as well as the governor, they stated that vaccinations for all will be eliminated. They have not given us a timeline of when they plan to do that, and we're also told that it will need signature from the legislature in Florida. However, some of them can be eliminated just by the governor and the Florida Surgeon General.
And there, do we know yet if it's eliminating the requirement to get them? They're not going to ban vaccines, or do we know that?
It seems we're pretty unsure about that.
Okay. So your recommendation, I guess, in two forms. Back to the COVID thing. Who should, when you go to when somebody comes to visit with you, who do you say, yep, I still want you to get the COVID vaccine?
So again, from the federal level, the recommendation is now individuals 65 years and older should get the COVID vaccination. Individuals under 65, if you have a health condition that's considered a risk factor for COVID, 5 years old to 65, then you should get the COVID vaccine. However, individuals 6 months to 5 years old, they're saying that they do not need the COVID vaccination. We know that the American Academy of Pediatrics, our leading medical association for our children, has stated that individuals 6 months to 2 years old are at most risk. And actually, Scott, in the last 50 years, when it comes to vaccinations, we've been able to save 40% of infants from mortality due to mass vaccination.
As that Florida situation evolves, and this is kind of a curveball for you, but are you at the point now where you're thinking, I wonder if someday I might have to recommend some of my families maybe don't visit there because of exposure that may be caused because of that?
Interesting question. I actually have a trip coming up in less than a month, and even my concerns are heightened because I'm wondering, will I be safe with everything that's going on down there? I do want Americans to know that we've always had the choice to get a vaccination or not get a vaccination for ourselves as well as our children. And there are exemptions that have already been in place. So that's what really has a lot of us physicians and healthcare professionals puzzled as to why now they want to eliminate these mandates. We do know that vaccination saves lives, especially our most vulnerable, and that includes our children as well as our elderly.
Some issues take one morning checkup. We're cleared up and on our way. This one may take 3 or 4. So
possibly.
We'll stay in touch with the topic of COVID-19. Dr. Janelle Gordon, thank you.
Thank you, Scott.
This is Medical Minutes, brought to you by Community Health Network.
Learn more and get more with Wish TV.
Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now.
Now at allindianapodcastnetwork.com.